This week's episode of Plastic Surgery Uncensored, I'm very excited. I have two wonderful guests, and we're going to talk about rhinoplasties, the journey of rhinoplasty, when, where, why, how, and everything else you need to know. You're definitely going to want to tune in. It's going to be exciting. It's going to be informative. So check out this week's episode of Plastic Surgery Uncensored. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. And I am very excited. I'm excited because this week's episode is about rhinoplasties. Anyone that knows me, follows me, knows that I love rhinoplasties. It's probably one of my favorite procedures to perform. And I am excited because we're joined by two fantastic patients who have honored us today by joining us because I have no shortage of information I can share with you about rhinoplasties, everything you need to know. But I always find that talking about subjects in a vacuum is not nearly as exciting and informative as speaking with someone who maybe had undergone that procedure. They can corroborate, confirm, or disagree. And I think it allows the listener or the viewer to really make sure and get a more authentic feel. Because, listen, I'm biased, right? It's not like I had my nose done, so I can't really speak that much of the patient journey. And I think when you hear it coming from patients, especially the two wonderful patients we have today, I think it'll help solidify some of the concepts. So welcome, ladies. We'll start with Emily. Why don't you introduce yourselves? And then we're going to get to know a little about your backstories.
Well, thank you for having me today, Dr. Roddy Raban. I'm Emily. I'm from Fresno, California. And I obviously got my rhinoplasty / septoplasty done with Dr. Raban. Thanks for having me.
Of course. Sharon.
Hi, Dr. Raban. Hi, Emily. Thank you for having me. I am Sharon, and I'm from San Pedro, California, and I got my rhinoplasty in September of 2020.
Right. And we also did
my chin augmentation.
Right. So we're going to chat about those things because I think both of you have every patient that comes has some uniqueness about them that makes their journey a little bit special, and we'll talk about them. So what I like to start out with is the idea of what's wrong with the nose, right? So people don't come to you because they love their nose. They come to you because they don't like their nose. And 9 out of 10 patients who come to me, when I ask them, so how can I help you? They're immediately say, well, I'm here for my nose and I don't like my nose. And then of course that followed up with what's wrong with your nose. And almost everyone says something to the following effect. My nose is a little big. It doesn't really fit my face. It's just asymmetric. And I feel like, it's just not balanced. I want something a little bit smaller in the instance of a female. I want something that's feminine in an instance of a male. I want something that's masculine. Oh, by the way, I want something that's really natural. I don't want anyone to know. Does that sound familiar, everybody? What does all that mean? All that means nothing. It means nothing. It's air. It's nonsense. It's not useful. Because we all know that the word natural, balanced, something appropriate, feminine, all those are subjective or general terms. They mean a lot to you, but may mean something different to someone. We all know someone walking around with arguably a terrible nose job who thinks that nose is phenomenal, natural, balanced. So the last thing you want to do is describe to your surgeon that you want anything, no less your nose, done that way, because you leave it up to interpretation. And God forbid your surgeon's feel for natural or balanced or feminine or masculine is different than yours. You're pretty screwed. So what I always like to do is I like to get into objective descriptions. What specifically is it about your nose you don't like? Is it the hump? Is it the bulbous tip? Is it that your nose is droopy? Is it that it gets wide when you smile? What is it specifically? And so we did that in both instances. And for a lot of patients, it's actually very difficult. You ask them that. They're like, do you have a mirror? Because you're like, I've never actually really had to describe what's wrong with my nose. I just hate it. And so it's very important that you do that exercise so that you know what's wrong. Yes. And then a lot of people are like, well, you're the surgeon. Whatever you think, or what do you think, or you're the artist. That's also a terrible way to approach it. Because yes, I have my opinions. And yes, you came to me because you like my work, but you never allow someone else, not your husband, not your boyfriend, not your mom, not your surgeon, decide for you how to end up. You do it collaboratively. That surgeon will give you input, will give you guidance, but will never decide for you that, oh, you need to have a scoop nose because I think it looks better on you. That's crazy. That is just nuts. So, Emily, what was wrong with your nose?
So obviously I came to you, Dr. Raban. My nose was severely crooked to the left-hand side, which really gave me a lot of anxiety in social situations. And then along with that, I couldn't breathe on my left-hand side due to the crookedness causing a deviated septum. And then along with that, I was also really self-conscious about the slightest dorsal hump, but I really focused on it. So for those reasons, I decided to get a rhinoplasty.
Right. And so when you came in and you say your nose was crooked, you had a legit crooked nose. I can't tell you the number of patients who come in. Like 90% of patients tell me their nose is asymmetric and crooked. And you and the rest of the world, like every supermodel, every actor, every actress, everyone's nose is crooked. That's not relevant. What's relevant is, wow, your nose is crooked. And indeed, your nose is really crooked. And as such, your septum was deviated. And as such, you had significant breathing issues. So everyone comes in and says their septum is deviated. Who cares? I mean, your septum is never straight. I can tell anyone listening right now, without ever having examined you, your septum is deviated. It just means that it's not straight. What matters is that impacting my breathing or is that impacting my cosmetics? And in your instance, it was. Sharon, what was wrong with your nose?
I broke my nose in 2019 and it was broken up here and it kind of accentuated the hump that I always had, my Italian nose. So I don't know, it made me more self-conscious about it. And it was just like, I had a deviated septum because of how I broke my nose. And it was just like Emily just made me very self-conscious. After I broke my nose, it was just something that I kept looking myself in the mirror and it's just like, I never felt like that, never felt like I didn't like how I looked. And it's not like you can lose a pound or two and feel better by yourself. It's right in the middle of your face. So I think it was more psychological for me, but also it was broken and had to be fixed.
Yeah. So the word it's psychological for me is it's for everyone. It's psychological for everyone. Because even if your nose is crooked and you can't breathe, in the case of Emily, which was really, really, really crooked, you breathe through your mouth. Everyone does their nose because it's psychological. You don't need to do your nose. You do it because you don't feel comfortable. You do it because it makes you self-conscious. You do it because you want to be able to take photos and not look at your focus on your nose. You do it because when you want to have conversations with someone, you don't want to stand on your so-called better side. Everyone does it because it's aesthetic, just like a breast augmentation isn't necessary. That being said, doesn't mean that it's any less worthy than removing lipoma. They're all important in different ways and no one needs to justify it. But the point is that you want to make sure that if you do it for a reason that you're going to end up having a happy outcome. Now, Sharon, we also end up doing your chin. So tell me, did you know about your chin maybe perhaps being benefited from an advancement or how did that come to be?
So I never really thought of doing anything to my face other than my nose. So when I first came to you and you mentioned the chin, I was kind of like, wait, what? Like, I never thought about it. And I never really paid attention to, I remember you saying, if you open any magazines, you'll see that every model has a very strong jaw. And I never paid attention to it because I honestly thought it was something natural. They were born like that. I never, my mind never went there. I didn't even know that, that was a possibility. And when you brought it up to me, at first I was very hesitant and kind of just like, okay, I'll take your suggestion, but I probably won't follow up on it. And then I went home and my boyfriend and I started looking at your portfolio and the before and afters. And we started noticing this time around that who had the chin done just by looking under the rhinoplasty section. And I was like, oh my gosh, I so have to do this. So that's how it kind of played out. Definitely a great suggestion. I always tell people, I don't know what I love the most, my nose or my chin.
Well, I can tell you I love your chin better because I'm just a chin man. But I think that's just an important conversation because rhinoplasty and ear pinning have nothing to do with each other. Rhinoplasty and breast aug have nothing to do with each other. You don't ever see me, everyone come into my office, and while they're there, I'm like, hey, have you ever thought of doing your eyelids? That's not my personality. I never promote or suggest anything that you haven't asked for, because it's just not, I don't know, I don't like the style of it. That being said, you come in for your nose, you look at your profile. There's no way I can really give you good advice about your nose without talking about your jaw. Those two are sisters. They're married. They're twins. If someone comes in and they have a prominent nose from profile and they'd like that profile to be improved, and they have a mildly weak chin or severely weak chin, I would be remiss not to mention it to you. I have to mention that in order for your profile to look the way I know you want it to look, you may not appreciate that the chin is participating, but it damn well is. So in your instance, and in the instances of half of the patients who do chin augs, I have to mention it to them, and the other half, they come and mention it themselves. What's important is just understand that when you're looking at your profile and you're like, I don't like the way this looks. My nose looks big and I don't know, it comes off my forehead. You should be aware that your chin may or may not be contributing, and recognize that if your chin is in better balance, it takes some of the pressure off of your nose having to be amazing. So when your jaw is strong, your nose almost is less important. That's the idea. So anyways, we did that. You guys did an amazing job. There's a few things that we ask patients when they come in. What are those? We ask about if they've ever had any trauma. Why? Because if you broke your nose versus you didn't, it's important to know. It doesn't matter if, a lot of people feel ashamed that they're getting their nose done. So they're like, well, I broke it when I was playing soccer. Because in their mind, they justify it. It doesn't matter if your hump came from birth, from soccer, from Jesus. It doesn't matter how you got it. What matters is you have it and you don't like it. And that's the end of that discussion. But of course, we like to know if you have trauma, and then we like to know if you have breathing issues. Why? Because your nose was designed, is created for breathing, period. It was never designed to be cute or pretty or balanced or nice or harmonious. It's an organ. It's for moving air. So if you come in and you can't breathe and you do a rhinoplasty and your breathing is not addressed, your breathing will get worse. And if you come in and your breathing is amazing, I have no problems, and you go get a cosmetic rhinoplasty and your breathing is not addressed, your breathing will be shitty. Your nose will have breathing issues if your breathing is not in discussion during your cosmetic rhinoplasty, because invariably the procedure is making your nose smaller in some way. Straighter maybe, hump, but it's smaller. So if you are creating an organ that moves air and it's big and then you make it smaller, well, then don't be shocked that you go read review after review after review that, oh my God, I had my rhinoplasty and now 2 years later, I can't breathe. People who follow me, people who read my stuff know that I'm very big on breathing. The problem is you usually go to an ENT for breathing and a plastic surgeon for cosmetics. And the worst thing on the earth you can do is go to an ENT, have them fix your breathing, take your septum out. A year later, go see a plastic surgeon and then have them do your rhinoplasty. Terrible, 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 terrible. Why? Obviously, you've now had 2 surgeries, but more importantly, is I need the damn septum. So I'll elaborate that a little bit and you guys will attest to it. But there's a principle, which is I need to do something structural and your breathing is important. Okay, guys, in addition to your exam, so let's shift gears a little bit to the exam and let's talk about some of those nuances. So I asked you guys and I talked to you about skin quality. Skin quality. The first thing I tell you during your exam. So you can have thin skin, thick skin, or average skin. Why that matters is when you do a rhinoplasty, you lift up the skin, you change the bone, you change the cartilage, you make it, ooh, that looks pretty. And then you put the skin back on over it. And then you do what? You wait 12 to 18 long months, not 12 to 18 weeks, 12 to 18 months, during which time the skin starts to shrink wrap over the new envelope. And then all of a sudden, lo and behold, there's your result. If you have thin skin, you see everything. Oh my God, I love my tip. It's so cute. But what the hell is this thing? I never saw that before, because the skin is thin. And if your skin is thick and oily and sebaceous, you're going to come back and be like, wow, this sucks. I came in with a bulbous tip and it's kind of still bulbous. You didn't do anything. In reality, I did everything the same as I did for the thin skin person who thinks their nose looks like amazing. Skin matters. So ladies, you guys are in. Emily, how far out are you from your nose?
I think in March, I'm coming up on 6 months.
Okay, 6 months. And Sharon?
About 3.5, 4 months.
Okay, perfect. You guys are right in the thick of things. You're right in the eye of the hurricane, right? You're in the ugly phase of the healing, meaning not that you look ugly because you look gorgeous, but ugly as in it's just sort of like, ugh. It changes every day. Every morning you wake up, you have some sushi, and the next morning you're like, oh my God. So this is a matter of your skin. So Emily, tell me about your journey in terms of, we talked about skin. What kind of skin did I tell you you have?
Yeah, so you told me that I had thin skin. So not only is my healing, I think, a little bit quicker, but I also didn't have much swelling after surgery, I think, in comparison to some of the other skin types.
And Sharon?
I have thick skin.
So
thick skin. Yeah.
You guys now know why you were selected. We have thin skin and we have thick skin. And that's excellent because everyone listening is going to want to understand. So what did you, so Emily, I do agree with you. You did have thin skin. Your nose is at 6 months, still swollen, no doubt about it, but your swelling post-op was minimal and you're just flying through the recovery in terms of not needing taping and massaging and all the nonsense you read online because your skin is cooperative. Sharon, how have your experience, what was your post-op like?
It was great as long as I didn't eat salt. When I ate salt, it was just like I blew up, my entire face just blew up. But I can definitely tell that there's at night, my nose looks a lot smaller than during the day. When I first wake up, sometimes it's like I have to do a double take in front of the mirror because it's so swollen. And there's times that I forget and I'm just like, oh my God, it looks so big. So it's just, I can definitely see how, for people that have thinner skin, they see less swelling, but I can definitely see, especially like here and here around my tip. And in fact, my tip is still kind of numb and it's like really hard. And it's just, I know we injected, I think it was last month or a month and a half ago, and I'm coming to see you again next month, but it's just like, I always ask my sister, I'm like, look, touch my tip. I cannot feel anything still. And it's so swollen that,
right.
It's just.
So you guys now represent what we talk about. Your live versions of what I say, thin skin versus thick skin. The process is different. Some of it has to do with skill, but a lot of it is your anatomy. And so we just have to recognize who you are, what you can expect, and how the journey will go. It will be different, and you just have to surrender and accept the journey. The next thing we talk about is obviously we talk about chins during the consultation. That's the moment that I mentioned to people, hey, by the way, just FYI, I noticed that your chin's a little weak, or hey, FYI, you got a great chin. That's when you and I, Sharon, had that conversation. And you obviously, patients who are not expecting it are like, okay. All right, I'll keep that in mind. Thanks, Dr. Raban. He insulted me. Now he says my nose is big and my chin is big. No, yes, I mean, I'm going to have to mention it to you, but if you are a person who knows, and I'm very sensitive about it, but my job is he educates you. I don't care if initially you're taken aback, but at the end, look at you now. I mean, there's no question in my mind, none whatsoever, that your jaw, your chin is significantly a part of your beauty now. And so great. Well, that's awesome. Good for you. We talk about the concept of open versus close. And I'm sure you guys were online doing your homework like good soldiers that you are. Both of you are very smart young ladies. You didn't just drive by the office and like, oh my God, look at that sign. That's so cool. Let's go get a rhinoplasty. So you read about the two methods, open and closed, for those listening and doing homework. Close is where the two incisions are just in the nostrils, and open is the same two incisions, except there's a third little incision, usually about 5 millimeters, across the base of your nose called a columella. The basic difference is you can open the nose physically like the hood of a car in the open technique. I do 99% of my surgeries open. I like the visibility. I like the accessibility of having an open rhinoplasty. It does not matter. All that matters is that your surgeon, whom you select, is skilled in the technique that you are doing. You go onto their gallery, you look at hundreds of photos, not 3 or 7, and you say, wow, this guy's work or this gal's work is amazing. And then you go there and they're like, oh, by the way, I do this really unique technique. I go through your earlobe. You sign up and you do it through the earlobe because they have demonstrated a proficiency with that technique as demonstrated by their results. Open close has a lot of debate. It's kind of like the Miller Lite commercials. Tastes great, less filling, tastes great, less filling. You know that commercial. Bottom line is it doesn't matter. The arguments in favor of open are countered by the arguments in favor of close. As I said, you just want to make sure your surgeon is skilled in what they do. I personally think the open approach gives you a great deal more visibility and opportunity to do certain maneuvers that I do that I don't know that are so easy to do closed. But I'm not going to harp on it other than just, hey, don't make a big deal out of it. So then we get into the concept of this principle, and the principle is the idea of reconstructive versus reductive rhinoplasty. You guys both remember that? The reconstructive versus reductive rhinoplasty. So traditionally, rhinoplasties were, and in some instances still are, reductive in nature. What does that mean? It means you go in, you say, hey, Dr. Raban, how's it going? Great. My nose is generally just big. Just doesn't, it's big. It's big. I need it to be smaller. So your surgeon will remove stuff. We'll remove the bone on the bridge of your nose. We'll remove some of the cartilage in your tip. We'll break the bone and push it in. We'll sew the tips together, at the end of which your nose is smaller, cuter, but weaker because we've removed stuff. And the analogy I always use is the Golden Gate Bridge. We run up to the bridge, we rip out a bunch of cables because the bridge is too big. And lo and behold, the next earthquake and boom, the bridge is weaker and it collapses. We run into the basement of the building. We rip out a bunch of columns and boom, the next earthquake, the building collapses. So reductive rhinoplasties, Bella Hadid is a perfect example that I use for every patient, tends to have more collapsing over time than any other, than the advanced techniques, because there isn't support. And as time goes, the nose continues to shrink and shrink, and then areas of weakness start to collapse. Then giving you that classic, oh my God, oh, looks so done. The nostrils collapse, the tip gets smaller, the nostrils raise up, the middle of the nose is pinched. So everybody knows what they hate. Everyone comes in and says, oh my God, Dr. Bond, I just don't want one of those like, I don't know, Michael Jackson noses. We know what it looks like and how does it happen, and this is generally how it happens. Reconstructive rhinoplasty is advanced modern day rhinoplasty. It's what we learned. What we've learned in 50, 60 years of rhinoplasty. We realize that if we remove a bunch of cartilage and make your nose smaller, it will look cute, but then it will get weak and then it will collapse. So what do? You put support. You put support where you weakened it. Whatever you took out is going to cause the weakening, and then you need to support it. How the hell do you do that? You need cartilage to support it, like beams and rebar. And where do you get that cartilage? From the septum in most instances. So every rhinoplasty I do, even if you come and tell me you don't have any breathing issues, I do a septoplasty because I want the damn cartilage, because I need the cartilage to put it inside the nose and support the nose for future reasons, right? And that is called reconstructive rhinoplasty. That nose job takes usually 3 hours, whereas reductive rhinoplasty usually takes an hour. It's in, it's out, boom, bam, damn, you're done. But when we have a conversation with these two ladies in 14 years, then we'll really have a conversation. 3 to 6 months is nothing. Nada, zilch. It's nothing. When we talk to them and they're, each 39 or 42, then we can have a real conversation, because then we are going to say, well, what does your nose look like now? And if you look at Bella Hadid or one of these celebrities, you can definitely say, they don't look so good as they did when they first did it, right? And so that I think is really important. So those are some really, really, really broad sweeping concepts. I really want you guys at home listening to hear them. These girls are like, oh, here he goes with his lecture again. But, I think it was important for them to know it. We're going to take a quick break. When we come back, we're going to shift gears and we're going to talk about the part where you guys are going to chime in the most, which is recovery. Risks. What could go terribly wrong? Because at the end of the day, every surgery, noses are high up there, can have some serious bad problems happen, and you want to avoid them. So, all right, guys, so listen tight. We're going to take a quick break. We'll be back with this episode of Plastic Surgery Uncensored. Welcome back to the second half of our episode. This is Dr. Roddy Raban. We're having a very interesting conversation about rhinoplasty, just garden variety, old-fashioned primary rhinoplasty. And I am joined here with two of my favorite patients, Emily and Sharon, and we're going to shift gears now and talk about recovery. I say a bunch of things, and I want to know if these patients are going to agree with that in terms of the recovery. So the first thing that patients want to know when it comes to recovery is, oh my God, I've gone online, I've YouTubed this. This looks super painful. I mean, black and blue and tape and breaking my nose and ugh. And I tell them, rhinoplasties, pretty mild pain. It's uncomfortable, but it's not pain like a breast dog pain. It's not like a C-section pain. It's not a liposuction pain. So was I lying or was that true? Emily?
It's definitely true. Just like you said, I definitely watched videos and reviews online of the recovery process, and I was definitely scared of it. The worst part, I would probably say, which I think you've mentioned before, Dr. Raban, is the packing. And it's really just feeling uncomfortable that you can't breathe out of your nose and that you just feel kind of stuffed up. Aside from that, I had some nausea with the anesthesia, which is totally normal, and you can combat that with medication. But the pain, honestly, I didn't even take my pain medication. I took Tylenol because it's so minimal. Like I said, it's really just kind of uncomfortable with being stuffed up and having tape all over your face. But it's really such a seamless recovery process.
Yeah. So it wasn't, I think the reality is it's unrealistic to think you're going to have something done to you, no less break your nose and blah, blah, blah. And it won't be uncomfortable. But pain is a different story. Sharon, did you find your procedure, at least your nose, to be painful?
No, not at all. Like Emily said, it was just the thought of it was what made it more scary to me than the actual process. And even my chin, both of my surgeries were amazing. The only thing that for me was a little bit difficult after surgery was recovering from the actual surgery, from being, under anesthesia. So
Sure.
I was very weak for about a week. And then I couldn't eat because of my chin, so I couldn't chew. So that was really hard for me, just to have to eat soups and soft food. That was really tough. But other than that, no pain whatsoever, no bruising.
It's to be expected you're going to have discomfort. It's to be expected you're going to be bruised. It's expected you're going to be a little nauseous. It's expected that you're going to be a little weak. There is nothing you do that your tubal ligation, gallbladder, hernia, blah, blah, blah. But pain in and of itself, like I'm going to have to brace myself, is not the case. You touched on packing. Let's talk about it because this is huge. I mean, massive. This actually is a reason why people do or don't do surgery. It's so big, packing, that doctors have made it their whole marketing ploy, which is I do packingless or scarless surgery. Remember, when you're a consumer, AKA patient, remember that doctors want your business. And as a result, they're going to market you. They're physically marketing you. They're not just saying, hey, look at me, I'm Dr. Raban. They're saying, I'm the world's greatest. I invented blah, blah, blah. So packingless is one of them. So what the hell is packing and why is there so much controversy? When you do a rhinoplasty, you do work inside and outside. And so historically, we used to put tampons or big torpedoes inside the nose to pack the inside the nose. We would put a tape and cast on your nose. We do the tape and cast, and I'll get into that in a minute. But taking out that torpedo was miserable. Of course. And so patients, again, wrote in every review and every online platform that the packing. So naturally, you're a patient, you're perspective, and you read it and you're like, screw that. I'm not doing no rhinoplasty. And so you were afraid of it. So then somebody comes on and says, I do packingless. Ooh, that sounds exciting. I like that. That's way better. So first thing you need to understand is why the hell were they doing the packing? Then you need to figure out what happens when you don't do the packing. So the packing was done for several reasons. Number one, bleeding. So we do break the inside of your nose. Some guys do it on the outside, some the inside. And so some of the packing is done to tampen out or stop the bleeding the first few days. Secondly, there's swelling inside the nose. And so I look at your nose as an Oreo. So the cream is in the inside. So I put a cast on the outside and you want to push from the inside to keep the swelling under control. So if you imagine you're swelling, it's going to swell. We opened you and closed you. It's going to swell upwards and downwards. And so that was a second reason. The third reason is they do work on the septum and you want to sandwich that in. So There are a lot of guys that no longer do packing, so that's up to them and no problem. I do what I refer to as a modified packing. So let me explain what that means. I don't use torpedoes. I don't use huge things. I don't leave it in your nose for months at a time. I pack your nose gently with gauze in the front end of your nose, because where I do the breaking of the bone, which is, everyone's like, oh my God, you're breaking the bone. Yes, I break the bone. You'll know no difference. It doesn't matter. All you care about is what these two ladies said to you, which is there is no pain. It doesn't matter what I do to you, just matter, it doesn't hurt, but there's bleeding that occurs. And I have found that in certain instances, enough instances that it's a problem, you get some bleeding from where I broke the bone for about 48 hours. So I gently pack the front of your nose. I don't push it all the way to the back to your brain where people think like, oh my God. And I use that to stop the bleeding for the first 48 hours so that you're not calling me at 2:30 in the morning with blood gushing down your face. Yes, maybe 80% of the patients won't have it, but 20% is a big enough problem where we don't want you being at 2:30 in the morning, panic struck having to run to the ER to have them shove some huge torpedo down your nose. So I have found that a gentle gauze that's placed in the front of your nose for 48 hours is well worth the exchange, and the patients just pull it on out. Simple, grab a tweezer, pull it on out. So that's my modified approach. It doesn't really matter as long as you understand why they do it and who does it and what's the reason. So that's the packing. Return to work. Okay, hey, when the hell can I get back to my school, my job, whatever you want to do? We usually say 2 weeks. Why 2 weeks? The first week you have a cast on your nose and some tape. The second week, we clean you all up, and then I put the tape in sort of this light cast on your nose again. Why? Because I feel like for the first 2 weeks, your nose is really swollen in cases like Sharon, maybe not so much as in cases of Emily. So the initial weeks of casting and taping for me is really, really important. It's non-negotiable. And for that reason, most patients don't really want to go to work or school or wherever. We live in a unique time. You can wear a mask now, but back in the day, you'd have to go back to work and explain to everyone what the hell's going on with your face. So I say 2 weeks. Could you work from home? Can you get on a computer? Can you make calls? Absolutely. You feel fine with the exception of mild cases where you're a little nauseous or a little whatever. Within 72 hours, you could get on a computer if you want. Ladies, Emily, what was your first 2 weeks like?
So like I said, I really had minimal pain. Once I got the initial cast and all the packing out, I'm working from home, so it was super easy for me to just hop back on and continue work. I did do video calls. I have a super close-knit team, so I didn't feel self-conscious by any means to do that. But I could see if I wasn't working from home, I probably would have stayed home for those 2 weeks, but yeah.
Sharon?
Like I said before, yeah, I was very weak. So I took a week off completely, and then I went remotely, just part-time. And then I went to the office right after you took the second cast. It was still swollen, but yeah, like Emily said, I had a really close team, so I didn't feel uncomfortable. But other than that, other than being weak from the surgery itself, it was great. Like, it didn't feel uncomfortable. It was just, normal, like going back to normal.
Yeah, I mean, you're going to go back. If you're Emily, your nose is going to look less swollen. If you're Sharon, your nose is going to look more swollen. But you certainly can go back, go to the supermarket, go live your life. So realistically, I say about 2 weeks before school and work. We say about 6 weeks before you can go exercise. What the hell? Why 6 weeks? I did my nose. Why? Because you're going to go work out. You're going to go do some cardio, lift some weights, do something. Your face is going to get flushed and swollen. Your nose is going to swell up, and then you're going to be pissed because your nose is swollen, and now you're going to have to wait a little longer. So I just think 6 weeks is a good number to wait. Nothing terrible is going to happen to you, but I think 6 weeks is a reasonable, good number where your body and your nose and your energy and your blood levels and everything comes back to normal, and you can kind of get going. Follow-ups. Okay, this is really important. I usually follow up patients more than any doctor you're going to meet. So you get a breast aug, I see you 5 times over a year. That's a lot. Most people see you 1 or twice. That's 5. When I do a rhinoplasty, I see you at 1 week, at 2 weeks, at 6 weeks, at 6 months, at 1 year, at 2 year, at 3 year, at 5 year, at 10 year. What on earth? Why am I seeing 18 months for 80% of your swelling to go away? 18 months for 80% of your swelling away. I didn't say 18 weeks. I said 18 months, and I didn't say 100% healed. I said 80%. Noses change forever. That's why when you go on IMDb, you find your favorite actor, and you look at them when they started their career and look at them now, and none of them look the same because their noses change over time. Now, the reason why I do structural rhinoplasty is so that change is minor and stable. But there's no question your nose will get better and better or worse and worse for sure. So anyone who does rhinoplasty loves it, thinks it's the most amazing things ever. They want to do it for a career. You cannot see patients back at 6 weeks and say, ladies, bon voyage. Keep me posted. Call me if there's an issue. I mean, what does that mean? I mean, how the hell do I know if what I did worked, didn't work, if the nose shifted? I don't know, the swelling didn't go away, the tip started to droop. So if you care about your patients, you love rhinoplasty and you want to do it as a career, you want to make sure that you and your surgeons have an established follow-up. Now, do you guys have to come to every visit? Not at all. It's up to you, but you sure want to have an open dialogue with your surgeons. And I would say that most surgeons will see you back at 2 months and then say, listen, everything looks great. It's just swollen. Just give it some time. Things will get better and call me if there's an issue. That's pretty standard. But I think that that's a mistake and you want to expect this to be a long life journey. Time in the operating room. So I think that majority of closed rhinoplasty done in a reductive fashion is done in about an hour. There's a surgeon in Iran that I just happened to see his Instagram, and he was bragging on his site that he does 9 rhinoplasties a day. Do you know what that means? 9 rhinoplasties. I do 2 cases a day. Okay, so I think that there is an amount of time that's an appropriate amount of time. If it takes you 7 hours, 8 hours to do rhinoplasty, I think there's a problem. But I think if you do it in an hour, there's no way on earth you're giving it the time and energy that it needs. There's just no way. There's no way to make a souffle in 12 minutes unless you pop it in the microwave. Yeah, you can't make a mural overnight. It just takes time. So I think that there's an appropriate time. And when your surgeon comes back to you and you're like, hey, so Dr. X, how long does it take? Oh, you'll be in and out in about an hour. I really think that should be, I should tell you something about the time it takes. All right, let's shift gears, ladies. Here we go. So this is the part that most people need to pay attention to. What are the risks with a rhinoplasty? So we talk about bleeding. Bleeding mean like hemorrhaging and I need to go to the ER. Thank God that didn't happen to either of you. We talk about infections, incredibly rare. Noses are so special. Why? Because your nose is filthy. It's filthy. You stick a Q-tip in there and it's got more bacteria than the floor that you're walking on now. And we open it up and it heals. If I took a swab of your nose and put it on your breast and stuck an implant in there, you get infected within 72 hours. So noses are really special and the area is very unique. So infections, not impossible, but are very rare. Scars, how are your scars? People worry about scars. It's the open approach. Therefore, you must have a scar. It must be hideous. Oh my God, how can you do that? So Emily, how's your scar?
It's great. I have people that don't even know that I had surgery on my nose because you really can't see it unless I deliberately look up and you're specifically looking for it. And it honestly looked healed. I know it wasn't completely healed, but you couldn't even notice it immediately after I got the cast off.
Yeah, so it's special. And again, nose skin, eyelid skin is what I call privileged skin. Privileged skin means the skin is really special. A 5 millimeters on your eyelid or 5 millimeters on the bottom of your nose heals incredibly well. 5 millimeters on your cheek doesn't heal so well. So it tends to heal very well, assuming that it's closed well. Now, horror stories. Oh my God, what happened to your nose? That's when someone does a crappy job. That's the case with everything. Terrible haircut, terrible outcome. Doesn't really matter. So assume that the work is done well. The question is, if you do a good job, does it heal well? And the answer is yes. What about you, Sharon? How's your scars?
Well, my nose one is almost, you can't really see it. Even when I don't have makeup on. When I have makeup on, it's completely invisible. But when I don't have makeup on, you can really tell. But my chin one took a little bit longer to heal. I feel like it was more swollen than my nose one. Like I could feel it being really thick. And this past month has kind of gone down a lot. And it was like purple for the longest time. I think it was just a healing process. Now it's much more like my nose, but it's taking a little longer. But again, it's like Emily said, I've seen people that I haven't seen in probably 6-7 months, and they look at me and they're like, you look great. and they don't know that I got surgery, and they're like, did you change your hair color? So that kind of makes me feel better, because people that know me can't really tell, but they can tell something is different.
Right. No,
So-
and so in regards to healing, your chin is always going to take longer than your nose because the skin is
Mhm.
not as privileged. And you're 3 months out. When do we say you're healed where we can really sit down and judge it? It takes a year for your
18
healed.
months.
Yeah, 18
Yeah.
months to a year. So I almost willing to bet you $1 million that at 18 months, you will never be able to find the scar under your nose or in your chin. $1 million. It's incredibly rare. So that's wonderful. So next risk, difficulty breathing. So what does that mean? It means you go get a rhinoplasty. Your nose looks pretty. It looks better. You're balanced. You look gorgeous. And now you have a hard time breathing. You struggle at night. When you exercise, you have a hard time getting in air. Your nose, your overall breathing is worse than it was before. And as we mentioned earlier, that's a no-brainer. I mean, you're taking a nose that's wide, bigger, and you're making it smaller and narrower. From nothing more than physics alone, just physics, you're taking a tube that's big and making it into a tube that's small. So it should never surprise you that your breathing is affected. Therefore, every surgeon should do something with your breathing, even if the patient is not complaining of breathing issues prior to surgery. So every surgery gets a septoplasty for 2 reasons. One is I need the cartilage. I need to do a reconstructive rhinoplasty. I need to put support in the rim of your nose. I need to put support in the bridge of your nose. I need to put support. And the other is I know your breathing is going to become compromised. So I'm doing what's called a preemptive surgery to help your breathing. And the second thing that we do is we reduce the turbinates. The turbinates are the humidifiers that humidify the air that goes in your nose. So when a person is breathing through their nose, they're moving air between the septum and the turbinate. So the turbinate sticks out of the wall, and the septum is the wall. So air slides between it. When you have a crooked septum and a large turbinate, air is tight. So we shrink the turbinate and straighten out the septum. Why would your turbinate be enlarged? Pets are notorious. I don't have any allergies. I love my cat. You think you don't have any allergies. You think you're not allergic to grass. You think you're not allergic to dust, mites, pollen. You are. You're just mildly allergic. You're not me, who's an asthmatic, but I assure you it matters. So we reduce that. And so the bottom line is don't be under this assumption that it's just a cosmetic rhinoplasty. Every rhinoplasty is a breathing rhinoplasty. So last but not least is the real risk with rhinoplasty. So I want everyone to listen carefully. The risk with rhinoplasty is irregularities, deformities, and asymmetries. Irregularities, contour deformities, and asymmetries. What does that mean? It means that when your surgery is done, 100% with absolute certainty, your nose will not be perfect. Your nostrils will not be perfect. Your nose will not be straight. So most of the consults today, I get this call at least 5 to 10 times a week is, hey, does Dr. Raban do any photomorph? Hey, does Dr. Raban do any Photoshop? Hey, what will I look like? 5 to 10 times a week. Most consults are not complex, thorough, specific. Most consults are, send us your photo. So you send them the photo, they Photoshop it, they bring the bridge down, they rotate the tip, they make it smaller, they straighten it out, do whatever. Sometimes you're like, ew, that looks terrible. They tweak it some more until you're happy, and then they send it to you. Or if you're in the office, they give it to you. And what will it say in the bottom right-hand corner of every single one of those photomorphs that you ever receive, every single one across the globe? Results may vary. Every one of them, for sure. Why? Because it says that you will not look like the photo we just sent you. So if you're an intelligent person, naturally you'd be like, well, then why are you giving this to me? Well, we're giving it to you because we know, we being the surgeons, that the only thing that prevents a patient from doing their nose, the only single thing that prevents you from doing your nose is fear. It will not be how much it costs, because let's say, oh, well, Dr. Bond, he's really expensive. Either you go to someone less expensive or you save your money. It won't be the time off work or school because you just wait for a vacation. It'll be fear. And it's not fear of dying, but fear of a terrible result, fear of a piggy nose, fears of a pinched nose, fear of that girl that you went to high school with, fear of your uncle, fear of Michael Jackson, fear of looking weird. And that fear prevents you from doing your nose year after year after year. If only I knew what I would look like, I'd sign up tomorrow. So as a surgeon whose goal ultimately is to get you to book, then what I need to do is lower your fear. So what I will do is I will photomorph the heck out of your nose until it looks like you like, and then I'll give it to you and you'll go, wow, that looks great. Hey, mom, hey, dad, oh, check this out. Oh my God. Look, honey, my wife, take a look at what I'll look. And everyone's like, wow, that looks better. And then you go, okay, I'll sign up. We all know, because it says there, you're not going to look like that. So what you need to understand is the reason you're doing this rhinoplasty is to be happiness. I want to be happy. I don't think you're doing it to be on the cover of Vogue or to be an Instagram influencer. You're doing it to be happy. So when you do your rhinoplasty, no matter who does it, where they do it, how they do it, what technique, I wish you could see this visually, but the bottom line is, if on the left side of my hand is your nose now, and the right side of my hand is your nose in perfection, when you're done with your rhinoplasty, you will end up close to, but never at the other hand. You'll always have something that's wrong with it. So in order for you to be happy, in order for this to be worth it, the time, the energy, the money, you have to be reasonable. I refer to satiable. You have to be reasonable, meaning that you have to look at the journey of where your nose started and where it ended up and go, well, holy crap, that looks so much better. Wow. Okay, I like that. It's straighter. Wow. No, I breathe better. Oh my, wow. Okay, great. And when you make that journey and you're happier, then the people that love you are happier because you're happy and they want you to be happy. And I'm happy because I want you to be happy, and everyone's happy. Happy, joy, joy. However, if you are nitpicky, difficult, critical, all of which I am, then you would come back and say, hey, listen, hey, Dr. Raban, hey, Dr. Smith, listen, the nose is better. Don't get me wrong. I mean, obviously the hump is gone and whatever, but you know what I noticed? But you know, like if you look from the base of my nose, the one nostril, like, you know, in this certain angle, let me show you this photo I took. If you are that individual and you know it because you know who you are, amazing, fantastic, you're going to be a super successful individual. Do not, under any circumstance, do your nose. It's a waste of time, a waste of money. You will spend all that time and energy, money, and you will, at the end, only be disappointed because you're unable to focus on the gain and only focus on what isn't right. It's a really important thing for everyone listening to understand. We do not have that issue with ear pinning. We do not have that issue with chinog. We do not have that issue with breast aug, really only with noses, because it's, as I think Sharon said, smack dab in the middle of your face, and you only look at it 4,444 times an hour. So you have to be a reasonable person for this to be all worth it. And so as a result, I'm not a photomorphing guy. I think it's misleading. And as a result, you need to be really realistic about this process. So here are my takeaways, and I'm going to then end it with you each giving your takeaway. It's number one, noses can be incredibly rewarding and powerful for a patient's transformation, self-confidence. You need to be realistic about what's possible. I think social media, it was the death of us when it comes to this particular issue, because you can put makeup on, you can contour, you can use certain filters, and everyone's nose looks amazing and no one looks like that. I think you need to be patient. It's a long journey. It's not a breast aug where 3 months later you're sitting in a bikini. You have to be willing to ride the journey. And I think you need to be very careful in doing your homework and finding someone that does both breathing, structural rhinoplasties, and not some guy who's going to make you some, you know, bird beak nose or some, what I refer to, stylized social media type nose. I think it's amazing. I love it. I do it every day, but I really think this session was very, very important for you all to listen. Emily, what's your take home for the listeners? What would you say about your rhinoplasty journey?
I would say it's really the biggest life-changing experience that I've had so far in my 24 years. And really a big takeaway that I would give to everybody who's listening and thinking about getting one of these surgeries, like Dr. Aban said, is to really do your homework. I know if I would have settled on the very first surgeon that I talked to, it could have been a very different outcome. So I think getting multiple opinions is really important, and to search up their different certifications and licensing. They can list 100 different amazing things on their website, but to really do your homework and dig deep and make sure that it is what they say it is, I think that's really the main thing.
Wonderful. And I know that you traveled, as do a third of my patients. If after doing homework in your area, you're not moved, you're not convinced, then go somewhere else. I mean, we live in an incredible time. You get in an airplane, you travel to Paris, you go to Istanbul, you go wherever the heck you're like, wow, this person's work's amazing. You're not going every week for dental cleaning. You're going once to get your nose done, and then you'll be back. So good for you for traveling. Sharon, what's your take home for those that are listening?
I definitely believe that you should do your homework, but I think a lot of it has to do with the mindset, as you specified previously. I am the person that you mentioned. I'm very nitpicky and I'm a control freak. So the thought of not knowing what my nose was going to look like was just like so overwhelming for me. And that was the fear that was keeping me for so long for doing my nose. So then I had to kind of switch up my mindset and say, you know what? I really dislike my nose right now. And I know that this person whom I trust has done all these rhinoplasty, and he's done a great job at it. So I'm gonna put my trust into this surgeon after obviously doing my research and all that, and just kind of like trust the process, I guess, because I always tell people this is the best decision I've done in 2020 because it completely changed the way I look, the way I feel, my confidence level. So I feel like the mindset has a lot to do also, just because like you said, otherwise you just waste money and time. So definitely do your research, do your homework, look at the before and after pictures. If you're a control freak, you need to just change your mindset and, just trust the person that you end up choosing as your surgeon.
Yeah, I think those are both incredibly important suggestions and things for people to consider. I'm so happy and grateful that both of you came on to have this conversation with me. You know how much I love rhinoplasty, and it means a lot to me that you guys, every single guest, I always say I commend you for having courage. You come on, you have a conversation, you put yourself out there, you do so for the benefit of anyone who's listening so that they can learn and stay clear of potential pitfalls. And I'm always grateful, as I am today, that you guys came on. And I think it was a great session. I hope whoever's listening found it to be useful. And that wraps up another episode of Plastic Surgery Uncensored. So make sure to tune in next week. I don't know what we're going to be talking about, but I'm sure it's going to be exciting nonetheless. I'm your host, Dr. Roddy Raban.